My name is Rabbi Joseph Robinson. I am the Director of Community Engagement at the Riverdale YMYWHA, and I also coordinate the Riverdale Jewish Community Partnership, which we like to call the RJCP. This partnership is made up of roughly 18 different Jewish organizations that span the spectrum of belief, practice, and thought. And while at times we differ in opinion or practice, we do recognize the strength in communal action and responsibility. To that end, we have gathered together today to help provide a bit more education and understanding around COVID vaccination and the rapidly changing guidelines for the health and safety of our community. As such, I'd like to bring forward one of our partners, Jonah Boyarin from New York City's Commission on Human Rights, to lead us to our next step.
Thank you so much, Rabbi Joseph. Thank you so much for hosting this program, putting it together. I also want to thank my colleague Derek Slaughter, our agency's Brooklyn director, for doing all the legwork on this and putting it together. And also I'd like to thank Rabbi Bob Kaplan of JCRC, who I believe is present and provided wise counsel for this program as well. As Rabbi Joseph said, Derek and I work at the City Commission on Human Rights. Our agency's responsibility is twofold. First of all, we enforce the city's human rights law, which is one of the strongest in the country. Basically, it means everyone in this city should be treated equally no matter who they are. So if you or anyone you know is treated unequally based on their gender or race or religion or nationality, any of those things and many more, we're the agency you come to report it, and you should have recourse with us. We can give you counsel on what your options are under the law. So you can call 311, ask for the City Commission on Human Rights, and make a complaint. That's the first part of our mission. The second part is community relations. Derek and I work in the Community Relations Bureau. Our mandate is to foster positive intergroup relations in the city and to be a kind of glue between government and communities, because we understand that communities understand their own needs best. They have their best solutions. They know what they need to get the best health outcomes in the community, to get the best community events going. We're here to support that and make sure that city government, which is a really large entity, is accessible to different individual communities in New York City. So my particular responsibilities, I'm the Jewish Communities Liaison. That's what brings me here, is outreach to Jewish communities in Riverdale. Without further ado, I'm gonna introduce our star guest, Dr. Torian Easterling. So Dr. Easterling serves as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene, that's DOHMH. Dr. Easterling has spent more than 5 years in a senior leadership role at the Health Department. Prior to serving as first Deputy Commissioner and Chief Equity Officer, Dr. Easterling served as Deputy Commissioner of the Center for Health Equity and Community Wellness at the NYC DOHMH, where he oversaw programmatic work focused on reducing overall premature mortality and closing the racial gap on the top leading causes of preventable death. He also served as the Assistant Commissioner of the Department of Health's Bureau of Brooklyn Neighborhood Health, where he helped advance key programming to address pressing concerns, including maternal deaths and gun violence. Dr. Easterling is a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. Dr. Easterling holds a Bachelor of Science from Morehouse College in Atlanta, Georgia, a Doctor of Medicine, MD, from Rutgers, New Jersey Medical School, and a Master's of Public Health, MPH, from the Icahn School of Medicine at Sinai in New York. He completed his residency in family medicine at Jamaica Hospital Medical Center in Queens, New York, and a general preventative medicine residency at Icahn School of Medicine at Sinai in New York. Without any further ado, Dr. Easterling.
Thanks so much, Jonah. So good to see you as well, Derek. Thank you as well, Rabbi Robinson, for hosting and bringing us together. It's good to see Rabbi Kaplan is among us, and just want to thank you all for holding this space and allowing us to share an update, and of course, here for any questions that you may have. And so, we want to just go through the update. And so I want to thank Anna for kicking us off and holding space, and who was also supporting me today. So I think it's always important to sort of start where we are. And I think the update is that it is promising. One, because we're seeing a downward trend, and that trend, even in the midst of the presence of variants, which certainly when you have a pandemic and the presence of viruses and they can mutate, certainly we know that variants are possible, and we have several variants that are present globally, and certainly there are several variants here in New York State. So we're continuing to monitor those variants right now. Certainly, we did see a jump in our percent positivity today, but we expect to see that fluctuation. But the upshot is that we are seeing a downward trend in our cases and our hospitalizations and deaths. And so that is promising, as I said, particularly when you have variants, because we do have a vaccine, and that vaccine does not seem to be resistant to those variants. But we certainly have to continue to do all the things that we know are important. So on the next slide, just going through our core 4 strategies, which remain important, certainly right now, that we continue to do the mask wearing and washing our hands and staying home if we're sick, and then also our social distancing. We continue to make sure that testing is available, and our New York City Test and Trace team is actually out more and more now that the weather is improving, to make sure that we're really hitting the pavement, letting folks know, reminding them about our core 4, getting that information out, but also with our mobile testing team, and you'll certainly see more in the community to really help individuals increase their access to getting tested. And even while you are going through that process of getting vaccinated, really important to continue to maintain sort of that routine of doing your testing as well as doing the core 4. And so that's also important. Next slide. And so we did update our face covering guidance. And so here, just to walk through it just briefly, better protection by wearing 2 masks. And so, having a cloth mask over a disposable mask, and I do this every day now, so I'm always wearing my disposable mask, and then I have a cloth mask that I wear as well. And now for certain individuals, older adults, individuals with higher with underlying chronic conditions, considering a single higher grade mask, such as the KN95, is important to consider. The N95, we still want to reserve for our healthcare workers, because they are certainly doing the work of serving and taking care of our most vulnerable and severely ill individuals in hospitals. And so we want to make sure that we have the stockpile for them to make sure that they're protecting themselves while they're caring for our loved ones. And so that's really important. We have a lot of the information on our website, both FAQs, which is really important, and also how to wear a face covering. Next slide. So just to jump into our Vaccine for All update, next slide. Here are the numbers, right now, but this is actually, I'm sorry, as of the 9th, but we continue to update these numbers, and I can just give you more recent numbers. So right now, total doses delivered actually, as of today on our website, is at 3.2 billion doses have been delivered, and that does include dose 1 and dose 2. And so certainly we're continuing to move high numbers. We're going to continue to see our numbers be stable for week to week for the next 3 weeks. So somewhere between 300 and 330,000 doses of vaccines being delivered in New York City. And we expect by the end of this month, certainly into the next month, we're starting to see some increase into our allocation and our being available for individuals to get vaccinated. And so certainly that's on the horizon, but where we are right now, we're sort of a bit stable about the number of doses that are being delivered to New York City. Next slide. And so really important here to also, really show how adults vaccinated by race and ethnicity and age Part of our work is really from the very beginning, is having an equity lens front and center from the very beginning. We look at it by geography. We want to look at this by race and ethnicity. And we also want to look at it by age. We know that there are inequities by place, by geography. When you look at certain neighborhoods across New York City, how are we making sure that we're closing the gap? And we're really achieving New York City vaccine for all. And this also applies for race and ethnicity and age, particularly for age and race and ethnicity, because we've already seen over the last year how COVID-19 impacts both of those categories. Older adults over the age of 65 have had severe illness and have experienced higher death rates than any other age groups. And then when you look at race and ethnicity, no question, we've seen double in death rates for Black and Brown communities compared to other race and ethnicities. And so this is the work that we have to do, particularly because we have variants. We want to make sure that we're really reaching out to those communities to make sure that we're protecting them because they do stand without removing those conditions that were present a year ago and decades ago, then they certainly stand to be most vulnerable to the variants as well. And so you'll see the disparities that exist now. We're looking at this both at the ages of 18 to 64, 65 plus, and then also all adults. Now, we do understand that there are a number of non-New York City residents who are being vaccinated in New York City. We're certainly trying to get that number down, but there are individuals who work in New York City who continue to support our economy. And so certainly we are making sure that they're getting vaccinated as well. Next slide. Also on our website, you can find adults vaccinated by zip code. And so this is going to be based on the population of New York City residents. On the left, you'll see neighborhoods that are shaded darker blue, and this is because this is based on individuals who received at least one dose. So this is partially vaccinated individuals, whereas the map on the right are individuals who are fully vaccinated. Now, the upshot is that we are seeing a high number of individuals return for their second dose. And so we are getting individuals fully vaccinated, but we're certainly not at 100%. So there is work that we can do to really make sure that individuals who have not experienced any allergic reaction and everything is fine, but making sure that they get their second dose. And so you'll see across New York City that we're not evenly shaded. And so there's certainly work that we must do. Now, we cannot compare neighborhoods. They're not apples to apples. There are certainly different population estimates because of how the population numbers, the estimates are for those neighborhoods. So, but certainly something that we need to continue to monitor, just like race and ethnicity and age, but also by geography. How are we making sure that we're seeing little difference between neighborhoods getting vaccinated, or their vaccination rates? Excuse me. Next slide. So the work of our campaign is focusing on an equitable distribution, and we've released our vaccine equity strategy. It is on our website, really talking through all of our strategies. How are we going to ensure that access, uptake, and outcomes are being done with an anti-racist and an equitable lens, but also thinking about how do we make sure that we're looking at the systems and the structures that perpetuate those inequities, that we're working to remove and dismantle them. We have to chip away at them so we can get closer to really achieving equity. And this isn't just around the vaccine, but these are all health outcomes. So this is the work that we continue to do. This builds on our equity plan that we built out for our COVID-19 response that we released back in May of 2020. And so this is the work that we'll continue to do, the work that I've been part of and been honored to be a part of at this agency, how we're making sure that we're looking at those structures and systems. And this is certainly an unprecedented collaboration that this is going to take. And so certainly across the many agencies within the administration, as well as partnerships in all of the neighborhoods like yourselves, and certainly with federal and state participation as well. All of this is running through our vaccine Vaccine Command Center, which is led by our Deputy Mayor for Health and Human Services, Mel Hartzog, in partnership with the New York City Department of Health, Test and Trace, and our New York City Emergency Management Office as well. So really there's a lot of work going in to make sure that we are well staffed and resourced to get this done. Next slide. So the basics. So we have 3 vaccines that have received emergency use authorization. All 3 vaccines are life-saving. They are safe. They are effective. They are no cost to an individual, even if they are asked for your health insurance card. It's really because the provider is making sure that they're able to receive the administrative costs through the health insurance, but the individual would not pay a co-pay or any type of fees. So no cost to that individual, and is not part of the public charge rule. And so certainly all information is kept private. These vaccines do not contain the virus. They do not interact with the DNA at all. 2 of the vaccines are mRNA vaccines, which is a newer technology, but has been researched for decades. And certainly there's a lot that we know about the mRNA technology. This really allows us to deliver that information, this genetic sequence, that message into the body. Once the message is read, it is deleted permanently. It's not integrating into your DNA or any nucleus or anything like that. But that message is able to replicate a protein that's found on the virus. The body recognizes that protein, and then you develop your antibodies. That provides you the protection that you need against COVID-19. For the Johnson & Johnson, which is not an mRNA vaccine, but it uses a viral vector to deliver that same message, that protein spike message, to make sure that you can then replicate and then develop the antibodies. But again, all of that is then permanently deleted, does not stick around in your body at all. So really important that individuals know that these vaccines have not seen any serious safety concerns during the clinical trials, and certainly during the course of this administration period, because we are monitoring all adverse events, which through the CDC and the FDA, and so which is really important. And then we're also seeing downward trends in our surveillance. And so I think all of this is showing that we're going in the right direction. And now we need to continue to make sure that we're getting vaccines in the arms of individuals, and particularly paying close attention to those individuals who are most vulnerable and who have been hardest hit by COVID-19. Next slide. The question of how does vaccines get to New York City? So we've been working with the federal government. As I already said, we expect a stable allocation over the next couple of weeks, but supply is still limited. We do expect some increase later this month into the next month, and that will allow us to really get more vaccines to our providers, to our federally qualified health centers, to our independent pharmacies, retail pharmacies, and all the sites that are in New York City. And that allows us really to offer more appointments. And so that's really important of how this can really happen. And so we're not at a place where we want to be. We want to be able to get 500,000 vaccines into the arms of New Yorkers a week, but we're not there. We're limited by supply. Next slide. And so the distribution and eligibility is important, because right now we certainly have a high number of New Yorkers who are eligible. And now who's eligible: healthcare workers, staff and residents who are at long-term care facilities. And the governor just announced and has expanded the age criteria to 60 and over as of Monday. And so if you are 60 and over, you are eligible to receive the vaccine. You need 3 of them based on their availability, based on the site that you're able to schedule your appointment at, including individuals who have an underlying chronic condition, and that can include hypertension, diabetes, heart conditions, or even a pregnancy status, certain frontline essential workers, and so first responders, teachers, childcare workers, also include grocery store workers, restaurant workers, individuals driving cabs. And we expect on the 17th, as the governor announced, that additional frontline public-facing employees, government employees, and we'll learn more from the state what other roles, what other job descriptions will fall under that criteria. So there's more that we need to know specifically about the additional groups that will be coming online March 17th. And so more to come there. But certainly we have a large number of individuals. Prior to the 8th, we already had about more than 4.5 million people eligible based on any of the groups that I mentioned, based on age and underlying chronic conditions, some of the frontline essential workers. And I've already shared the number of doses that have been delivered to New York City. So we certainly want to get to matching supply to demand. Next slide. As I mentioned, certainly the work of government and of our agency is really keeping equity front and center. And so it's thinking about how we're using our data. How is that data both informing the gaps, but we're using it as a roadmap to really fill those gaps as well, form how we're prioritizing. And certainly we want to continue to make sure that we're focusing on our seniors, individuals who are 65 and older. Our surveillance data that we've continued to look at, we've seen how COVID has impacted this age group. So we want to make sure that we're protecting this age group going forward. And so that's certainly a priority for us, even though we still want to make sure that everyone who is eligible still have ways that they can schedule an appointment. And then we are continuing to work to build confidence. This is certainly the work that we have to do. But what we're hearing, we're continuing to hear that there's more interest, that there's more demand in communities across New York City. And so the priority is really making sure that we're enhancing and optimizing access to the vaccine for those who want it. And so this narrative that there's hesitancy in this community and that community, I think it's really important that we continue to show ways that we're really trying to connect people to the appointments, really helping them address questions and concerns, because largely the questions that I get are, how can you help me get an appointment? How can I schedule an appointment? I think that's really important because individuals know how important it is getting back to some level of normalcy for themselves and their family. And so we'll continue to work with our leadership here in government, led by the Executive Director of the New York City Racial Inclusion and Equity Task Force, and working on ways that we're doing all the partnerships. Sadia Sherman, who's also at New York City Housing Authority. We're really making sure that we're thinking about our collaboration, thinking about we're leveraging partnerships for all the different agencies, and really thinking about innovative ways that we can continue to support and reaching those who are most vulnerable. And so it's really important. Next slide. And so we do have our website, and so on vaccinefinder.nyc.gov, and we are trying to get to a cadence where we're releasing appointments on the website for those who are adept to really navigating the website, scheduling an appointment on their smartphone. We also do have a call center at 877-VAX4NYC, and really making sure that our seniors can get through to one of our call lines. We're making sure that not only thinking about our seniors, but also if English is not your first language, how are we making sure that our information on our website is translatable to the 10 major languages and more at times. Also our frequently asked questions, and also thinking about ways that we need to communicate and navigate through the call center. And so also making sure that we have a language line available. Transportation is available for our seniors, and which is also important, helping them get to and from any provider. And so it doesn't have to be a city site or a health and hospital site. Any site that you're going to get a vaccine, a senior can sign up for transportation, and that's either a cab or ambulance services that does provide a wheelchair. Next slide. And so we continue to work with a number of organizations, making sure that we're getting the information out about vaccines, about where they can, schedule appointments, questions, concerns, like having conversations like this. But really, it's about the dialogue, because at one point, there could be a host of questions around scheduling appointments. Another point, there could be a lot of questions about what we're hearing in the news about the vaccines or about the Johnson & Johnson vaccine and the efficacy. And so really being available to respond to those questions, but also on our website, we are updating information regularly so we can make sure that individuals do have information at their fingertips. And it's not only our website, we also see this with the Center for Disease Control. They're updating their information as well. And we also try to stay abreast of the misinformation and disinformation so that we can respond rapidly, so that we can reassure New Yorkers and everyone that the vaccines are safe and that what you're hearing on Google or social media is certainly wanting to make sure that folks are following fact-based information. And that's really important, that we're really surrounding people with factual information, really to build confidence. And I think that's really important. And certainly the partnerships, and you as the messengers are certainly really important. What we've been hearing from, through our surveys, through a lot of conversations, is that providers, whether that's your doctor, your pharmacist, certainly we hear from our seniors that they really rely on their doctors and their pharmacies for this type of information. So we continue to partner with a number of different provider groups to make sure that we're building their confidence in their capacity to be able to respond to these questions as well. Next slide. So really important, just as a reminder, if eligible for a vaccine, you can log on to our website, also call our line. Also, we've been partnering with a number of different organizations. I'm really happy to be partnering with JCRC this week in our ongoing partnerships to also continue to outreach to seniors to make sure that we are getting them matched up with an appointment. We're still making sure that everyone knows how important it is to follow our core 4 prevention strategies, even if fully vaccinated. And certainly we've seen some updated guidelines for individuals who are fully vaccinated, but certainly it's important when in public that we continue to follow our core 4 prevention strategies, including wearing a mask. A lot of this information is on our website, and again, we are constantly updating our website to make sure that we're staying abreast of this information. This information is rapidly moving, and so we're continuing to learn and make sure that we're getting it out as quickly as we can.
Dr. Easterling, thank you again. This is some really good, strong, solid information, and also linking us to the different places to dig a little bit deeper on some of those elements that you spoke about. We would love to take a few moments to ask some follow-up questions, some of which you may not be your wheelhouse, and I think that's perfectly okay to say, I would defer to my colleague over here, and then put us in touch with those people. We'll happily try to follow up with them. There was a question in the chat, which I do think is helpful. There was a question about the vaccine itself. Is it to help establish immunity, or is it to prevent serious symptoms of COVID-19? And maybe you can speak to how it helps in those two areas.
Yeah, so that's a really good question. So 2 ways that vaccines help us and they are beneficial to us. As you stated, Rabbi, vaccines do help develop an immunity against a disease and protect us against severe illness and death. And that's really important. And all 3 vaccines are highly effective in preventing severe illness and hospitalization and death. And that's what we do know. The second way is also about preventing us from getting the virus or disease in the first place. And so that's what we certainly want to happen. We know that the vaccines do, number 1, preventing severe illness and death. But also, there's more that we need to know about the vaccines as far as the second category. And so as far as disease transmission and whether or not, even if I'm fully vaccinated, can I transmit it to someone else? So, I think there's more to learn more on that, but it's really important that we know that these vaccines are highly effective in preventing severe illness.
Excellent. So it's the vaccines are primarily about prevention of the virus.
That is correct. They have not been tested or any type of trial for for post-exposure, after being exposed, and then once you've already experienced those symptoms, do you then get a vaccine? So different category, different role, but vaccines are about prevention. Yes.
All right, excellent. So I'm just trying to go through these questions that are here, and then we also had a number of other questions. So could you speak as a medical professional, your experience with those other professionals who are opposed to the vaccine? Other doctors that may be telling their clients that you shouldn't get the vaccine or it's not appropriate right now. Could you address that perhaps?
Yeah, I mean, I would just say that, if a medical provider is suggesting that someone should not get the vaccine, I think that person should seek a second opinion. I think we just need to have a full conversation about the benefits, any concerns or questions about the vaccines, there's some providers that may, have their own position about why they are not accepting of the vaccine. I try not to, get into any back and forth about misinformation or disinformation, but it's really about staying with the science and the data, what we know about these vaccines, so that they are life-saving and effective. So, and the safety concerns are also, or the safety of the vaccines have also been proven as well. So I think that's what I would normally say about anyone who's thinking or speaking to a provider who's saying that you shouldn't get the vaccine.
Okay, excellent, thank you. Could you also, in the vaccination process, we know that there are, like any medical treatment, there could be some potential side effects, soreness, exhaustion. There's a lot of things that come, and there are questions about the longevity of some of those side effects, or the side effects are related to COVID? Are they separate? Could you maybe speak to after the administration of a shot, what are some things that we should expect? And what are some things that we should then go speak to our medical professional as a follow-up about?
Great question. So I would just say that I received both my doses for the Moderna vaccine. And so I've experienced some of the things that I'm about to talk about. But, the most common reactions is that you can experience soreness in the arm, which I did after both doses. You can experience lightheadedness, dizziness, or body aches and chills, or low-grade fever. Those are common reactions, and that they have been reported. They typically last between 1 to 3 days, and typically will resolve, and you'll be better after that first day, 24 hours after the injection. More likely to experience most of those symptoms after the second dose. After the first dose, most people do not experience as many symptoms. It's likely the soreness in the arm, but certainly after the second dose, more likely to experience other symptoms as well. So certainly can plan accordingly. Some providers do recommend that you can take Tylenol or ibuprofen, which is totally fine, after receiving your being administered with the vaccine. Certainly that is appropriate. And I just served at one of our vaccine hubs this past weekend on Saturday as our medical greeter, and really engaged a lot of individuals who had questions about if it's okay, I can take Tylenol or ibuprofen, and certainly it can. That is fine. You will hear that some people have can experience allergic reaction. Now, usually those are individuals who have a history of allergic reaction. It's not as common, certainly not as common as soreness in the arm or having dizziness or body chills. Usually someone who has a history of allergic reaction or is allergic to some component of the vaccine will experience that, but very, very unlikely compared to the other reactions that I just talked about. So this is very uncommon. Usually someone would either know that they have this history of allergic reaction, or if they are carrying an EpiPen. And so this is something certainly you want to talk to your provider about whether or not, I should proceed with getting my first dose. And totally, if you have no history of it and you are getting vaccinated and do experience an allergic reaction, and certainly we have clinicians on site, such as myself or other clinicians, to be there to respond. But if that happens, then that person would then talk to their provider about whether or not they should proceed with a second dose. And then the other thing that folks should also be mindful of is that it is not recommended to receive a vaccine if you just received another vaccine for whatever reason, 14 days prior, within 14 days prior to receiving that vaccine. And so this just happened recently when I was working at one of our vaccine sites. I had to advise the person, because they had just received the vaccine a little over a week ago, less than 14 days, that they should not receive their vaccine dose at that day. And they would just come back, and we rescheduled them for their appointment that day. And so they did not lose their appointment, but we want to make sure, based on guidelines, that they at least had more than 2 weeks out before they receive that vaccine. So certainly that can be taken care of. And so I think those are the ways that people should just be mindful about what to expect.
Amazing. Thank you. And if there, just as a quick follow-up, if there's any bruising or anything like that, again, to seek the advice of your medical practitioner. Yeah. Okay.
That's right. Yeah.
Amazing. Thank you. So we're looking at roughly 3 days or so has been the average of side effects after an injection. With your permission, I'd like to shift gears slightly and talk about some emotional sides of the vaccine and mask wearing, etc. We know that the Jewish holiday of Passover, and we know that Easter is coming. There are anniversaries and birthday parties and baby namings and so many other things that are coming up, and the weather is changing. Can you give some thoughts and advice and procedures, protocols on how to address some of the social, emotional needs out there with some practical tips? Can I go see my grandmother who has been vaccinated, but I have not yet? Or vice versa, et cetera?
Yeah, I think this is certainly on top of mind for a lot of folks as they are becoming fully vaccinated. Let me just start with who is considered fully vaccinated. And so someone is fully vaccinated 2 weeks after they received the second dose of a 2-dose series, such as Moderna and Pfizer, or 2 weeks after receiving the 1 dose for the 1-dose series, like Johnson & Johnson. And so those are individuals who are fully vaccinated. And so do not want to minimize how important that 2 weeks after that final dose in that series is to take. And so really making sure that you're doing all the things, really almost considering yourself not fully vaccinated, and really approaching how you're interacting, making sure you're wearing a mask, and all of those things. And so we do know that CDC has just put out guidelines for individuals who are fully vaccinated. There are certainly more that we need to know and learn, and we do see that the CDC is trying to relax on some of the guidelines for individuals who are fully vaccinated. And certainly the health department is reviewing all these guidelines and plan to update how we're thinking about our own recommendations for New Yorkers. And so far what we know and that individuals who are fully vaccinated, right, they're able to come together in small gatherings with other individuals who are fully vaccinated. So also want to make sure that, you are protecting yourself and others by also coming together with other individuals who are fully vaccinated. Also want to be mindful of individuals who are not fully vaccinated or unvaccinated, particularly if they are at higher risk. So you still need to consider someone's age and also someone who has an underlying chronic condition. And so find if, say a grandmother or grandfather is going to see a younger person who is not at higher risk, they do not have underlying health condition and they're younger, and certainly that's okay, and certainly that's fine. One of the things that CDC did not change is travel for international and domestic. And so, certainly, again, that is something that we're reviewing, our own data and looking at it, but, we're not necessarily going against federal guidance. We just want to be able to be clear about how we want to message and communicate. So nothing confirmatory right now. And this is something more that we're going to have to share as we go forward. So I think we need to be cautiously optimistic right now. And so individuals who are fully vaccinated can congregate in small gatherings with other people who are fully vaccinated, as we're hearing from CDC. And so I think we're going to hear more before we reach Passover, and certainly we'll be putting out additional guidelines soon. So it doesn't really get to your question, Rabbi, in a really concrete way, but this is what we have right now. And I think it is helpful that if individuals are coming together, they're still keeping their gatherings small, still primarily with household gatherings, folks who are already fully vaccinated. And I think that will give some reassurance that you are still protecting yourself and other people as well. Certainly the weather is nicer. Folks want to get out more. And so really important that we still practice a lot of the things that we've been doing. So even if you're going to be outside, that also decreases the risk of exposure when you're in an outdoor setting, still maintaining 6 feet apart and that social distancing. So still maintaining all of those things while wearing a mask. And certainly even if you're fully vaccinated, you should still wear a mask in public. That's really important. It has not changed.
And again, I do recognize that things are changing rapidly, and hopefully that information, as you said, will be posted on the website soon, so that we have more guidance as we get closer and closer to this new holiday season, and recognizing also that that some people have already begun to make some of those travel plans, and the recommendations of travel are still in effect. The protocols and procedures are still in effect. So that's important to know for our communities, to share that, along with how to gather with fully vaccinated individuals. As somewhat of a follow-up, and I recognize that time is coming short and I don't want to eat up too much more of yours. We're blessed to have you. Can you talk about transmission? Those people that have been fully vaccinated, are they still, you are recommending still the distancing, the hand washing, the mask wearing, but what are your comments on transmitting the virus if you've already been vaccinated?
I think what I will say to that big picture is that we do see promising trends for individuals as we're rolling out our vaccine distribution, as I've shared. Although we are seeing higher rates of presence of the variants, and so thinking about all those individuals who are testing positive for the case, higher number of those individuals are showing up with the variant. So that means that the variant is more present, that is certainly more infectious. That much we do know. But we're not seeing certainly an uptick in more individuals certainly showing up positive. And so that does give us some indication that our vaccines are working and they're keeping people safe. So that's good. But we still need people to continue to do, while we're rolling out our vaccine, we still need individuals to do all of our core 4 prevention strategies, because that is certainly helping us push back and fight back on the transmission. The vaccines can slow down transmission. We know that because you're less likely to prevent symptoms, less likely to be, more likely to be wearing a mask and to be reflecting these symptoms. And that means you're less likely to be projecting any respiratory droplets, because we know that's how the virus is spread. And so these are all very important, and we need to reinforce what we know about the virus, how it spreads, how we can really minimize transmission. And the vaccine can also help with that as well.
Dr. Easterling, thank you for your time, your expertise, your insight. It really speaks volumes that you're willing to take the time to help educate our community in this really important work. I want to also thank the Commission on Human Rights for partnering with us on this webinar. Jonah and Derek. Also, many thanks to Anna behind the scenes helping with some of the technical work. Thank you for that. May we continue to look out for the health and safety of our community, and may we soon be able to share these sacred moments live and in person in the near future. Thank you all, stay safe, and keep doing the hard work that we know you can.
Thank you very much. Thank you.
Thank you.
Thank you. Take care.
Thank you, Doctor.